In this short video, I'd like to sort of demonstrate what you're looking for when you're looking at these chart deficiencies and doing your analysis. So I just created a sample patient for us to take a look at. So what you'll want to do before you start to look at this sample patient is to have your printout of the analysis checklist in front of you. So I have my patient all set up here. So you would be in your patient on the overview and resources is where you would print out your checklist. Then you'll go to step 2, which is review the EHR. I'm going to just go back into the session that I had worked on before here. So we're going to start here with looking at our patient. The very first section we have is overview. The first thing that it wants to know is, are the allergies identified? We can tell if we have checked the allergies for this patient in a couple different ways. We can look here at the patient information tab and see that we have no known allergies listed there. We could also go to the alerts section and we can see that we have made a note that this patient has no known allergies. So you can go ahead and make an X next to the box that says allergies. The next box asks about advanced directives. So the patient is a full code. And let's see, where else can we look? If we go to the notes and we look for an admission note, so we find one here by the nurse. If we scroll through the admission note, we're just going to look and see what the nurse talked to the patient about. And we see here under the advanced directives section, the patient does not have an advanced directive and does not want to create one at this time. So we know that we've discussed that with the patient. They don't have an advanced directive. They are a full code. So mark an X under advanced directive. We don't need to mark deficiencies, incorrect, or incompletes because these criteria were both met. If we move on to the data elements, these things are usually found in the account tab under registration, encounters, and insurance. So we're going to go to the account tab, and here we'll look at registration. So when we first look at registration here, we've got our patient's name. We see yes, sex is identified. I can mark that box. Race, ethnicity. We have that identified. Mark off that box. Residence. We have her address listed here. Mark off that box. She has a medical record number. Mark off that box. This is not a newborn, so we can mark NA for not applicable. Admission date. That is not on this form, but if we go to the encounters form and notice that these two encounters took place in the clinic, we need to look for hospital information. So what do we find here in encounters? We see the date that the patient was admitted and the date that the patient was discharged. So we can make an X there. We know the admission date. The type of admission, inpatient. So we'll mark inpatient. Expected source of payment. So if we look at our encounter details, we don't find anything else about the patient. But if we go to the registration section, we can scroll down here and we can find the guarantor information. Now the guarantor is the person who says, I will pay for this. So Anna says that she's going to be able to pay. We can also look at the insurance tab and we can see that she's covered by insurance. So we know that we have the patient has agreed to pay, and we also know that she has insurance to supplement her payment. So we can mark expected source of payment. Then we'll move on to the problems area. Most of these we can answer by looking under the health tab. Then we'd be able to look under for diagnoses, problems, or reasons for admission, usually on the problems tab, which is here, or under the notes on the physician admit note. So do we have a principal diagnosis? Where are we going to find that? Probably under the notes. And let's see, these are clinic notes. We don't have a physician admit note. So the only thing that we can look at right now is the nursing admit note. So when we look here, does it list what is the principal diagnosis? No. It lists that the patient is admitted for a laparoscopic cholecystectomy, but it doesn't tell us what the patient's actual diagnosis is. So as we scroll down through the rest of the document, that is not listed. So since we don't have it listed in the nurse's admission note and we don't have a physician admit note, we need to mark this one as deficient. So deficient means that it's missing completely. Incorrect is obviously that it's incorrect, and incomplete, there's some information, but not all of the information. So it comes to other diagnoses. We don't find other diagnoses listed either, so that is marked deficient. The reason for admission is cholecystectomy, but we don't know why the patient is having that. So that is also deficient. So we're going to make a comment. There is no physician admit note and no diagnoses listed in problems. Query Dr. Padma Emil. So we need to talk to the doctor and find out what these are. What is the reason for admission? What's the principal diagnosis, other diagnoses, and that reason for admission? Physician's orders, those are found here under health and orders, and there's a whole list of them here. Are they signed by the ordering physician? So we can just click on one and look. Here's the ordering physician, and under the order details, we do see that these were signed. So what you'll need to do then is look at each one of those orders and make sure that it was signed by the physician who ordered it. Now let's just take a look at one of these. Notice that the author, the person who's entering the order, is not always going to be the ordering person who would be the provider, but the ordering provider is going to be the one who's going to sign the order. So nurses can write the orders, but the physician has to actually sign the order. So we need to look and see if we have an admit order. So we're going to go stay here in our orders, and at the bottom is where we start. So notice again, ultrasound. If we click, it tells us where this was. Okay, it was on the 11th. It's an ultrasound. It was signed, so that's not our admit document. Whoops. All right, so what we're going to do is just look through here. These are medication orders. Okay, here's an admission note dictated by the nurse for the physician. So we have an admit order, and it is signed. So we can close there and mark that as, we'll check written and signed. Discharge order. So I am on the order still. I see a discharge order. Okay, it was written, so we can mark that. It is signed by the ordering physician. Those are the only two marks that we need to make there. Physician discharge summary. So we're going to look at the notes. Discharge summary note. Here's the physician. The author is listed in this column. Is it written? Yes. Is it signed? For this, we'll look at the bottom. Yes, it is signed. The final diagnosis. It does not say discharge diagnosis on here. So that is deficient. Principal operation or procedure. Let's look and see. Indications for procedure. It does list what the procedure performed was. Notice here under postoperative diagnosis, chronic cholecystitis resulting from cholelithiasis of the gallbladder neck. It still doesn't give us a preoperative diagnosis. So we do not know admitting diagnosis. We need to mark that as deficient. Summary of the hospital course. Patient is admitted for day surgery, so this paragraph here is a summary of the hospital course. We can mark that. Summary of lab and diagnostic data. Let's see, what do we have here? So just take a minute to look through and see what you've got here. Okay, we have vitals, assessment, discharge orders. So we don't have a summary of any lab or diagnostic testing. So we're going to mark that as deficient. Discharge and aftercare directions. Yes, we have a whole list of those. So put an X there. Condition of patient at discharge. Patient stable. Okay, so we can mark that as completed. Disposition of patient, discharged to home. So then we're going to mark the box for physician queried regarding admitting diagnosis, final diagnosis, lab and diagnostic testing. So what are we going to ask that physician about? So just kind of looking at other things here, is there a discharge progress note? So we're going to go back to our notes. Here is discharge. Here's a nursing progress note. Here is the nursing discharge. What am I looking for? I lost track here. Okay, progress notes. Here's a progress note from the physician. And we're going to scroll through and see what we have here. One problem with our discharge progress note, there's no signature. So we would mark this as deficient, put the doctor's name in there, no signature. Physician history and physical. Now notice there's a history and physical here, but this is by a different physician and it's not at the hospital, it's a clinic. So our Dr. Padma Emil did not dictate an admission history and physical. So that is missing. So we'll mark the doctor, write her name in there, write deficient. All of the items that follow that are deficient. Physician queried Dr. Admel regarding missing admission H&P. So this physician is going to need to dictate that admission H&P. We don't have a physician admit note. We don't really need that because we're going to get the A and P. There were no consultation orders or reports, so those are not applicable. Daily physician progress notes, we saw that. And that was the note that was not signed. Consent for treatment. So we would look under orders. And we have consent for surgical treatment. So it's a consent for treatment. There's no place for the patient to sign this, but if we have the physician sign, then we know that the patient did sign. So we can mark consent for treatment, signed by patient, signed by physician. And this is also the consent for the procedure. So that is signed by patient, signed by physician. We don't have any of this anesthesia or pre-op or post-op recovery, so mark not applicable to all of those items. Operative or surgical report. So we're going to go to our notes and we'll look at the surgery note. Now notice who dictated or authored this. This is the nurse. It describes the pre-op condition, the post-op diagnosis, what the procedure was, the anesthesia. It describes the entire procedure. The person who performed the procedure is the person who should be writing this report. So what we need to do is query the physician and say, is this a mistake that the author is listed as the nurse? Was this dictated by the nurse for the physician? If so, it should say that. And the physician still has to sign the document. And we don't see any signature here. So we need to query the physician about this, this operative report. It is deficient in every area. And we need to query the physician. Was the author the RN? Or did the physician actually dictate this? And when are they going to sign it? So that's a deficiency. A nurse admission note. Here we do see the nursing admission note by Kim Anderson. Nurses do not have to sign documentation that they create because they create the documentation under the auspices of the provider who's overseeing them. So that's the person who is ultimately responsible. So the nurses themselves are not signing this. Okay, daily nurses or progress notes. So here is a nursing progress note, and we can see that that was entered. So we'll check the box next to nurse and write in Kim Anderson RN. Lastly, we come to lab, or I shouldn't say last, next, lab reports and results. So we're going to go to, let me find these, labs. All right, the quickest way to find a lab test is to just click. So we're looking for, do we have a complete metabolic panel? Yes, we do. Here's a complete metabolic panel. Here are all of the tests that are involved in the metabolic panel. So we'll make a check mark next to complete metabolic panel. Number of panels, 1. Because if we look here, we've only got 1. CBC with differential. We have a CBC with differential. Here are all the components of that, and there's only 1. So mark CBC with differential, number of panels, 1. Lipid profile. We do not have a lipid profile. Urinalysis. No urinalysis. Do we have other labs? We do. After our complete metabolic profile, we have a coagulation screen. So under other labs, 1 is going to be a coagulation screen, and 2 will be an HCG. So we have 2 other lab tests. Pathology reports or results. If there was pathology, it would be listed in this section. None of the documentation that we saw said anything about a specimen being removed and sent for laboratory examination. So we'll mark not applicable to this. Yeah, let's go on to the last page here. Radiology reports. We don't have any hospital radiology reports. The ultrasound that the patient had done was at the clinic before they were admitted, because that ultrasound is what gave this physician the diagnosis to say that they were going to admit the patient to do the cholecystectomy. So that's not applicable. There was no PT, RT, OT, or ST. No nutritional initial evaluation, so not applicable. There's no social worker evaluation or case manager evaluation notes. We also have no nutrition or dietary evaluation or notes. So that covers everything that we're looking at for the patient. And let's see. Whoops.